and good evening to everybody. Welcome to the Maternity and Midwifery Hour. Sorry, we're a few moments late, but we're worth waiting for. We're worth waiting for with the Christmas tree also, and my lovely speakers this evening. So you're going to enjoy this evening. Well, at least you should enjoy, but I'm sure there'll be a little bit of a challenge from our speakers, because there always is, and that's what we like. Now, my name's Sue MacDonald, and I'm the very happy curator for this Maternity and Midwifery Hour and the Maternity and Midwifery Festivals, one of which we had yesterday, and I might talk a bit about that later. And tonight's the 12th of Series 8, and we're going on to Series 9 next year too, so stand by for that. And we're delighted to be joined this week by Jo Frame and Alice Clack, and they're coming to talk about sustainability and climate conscious care in maternity, which is so up to the minute and what we need to be thinking about. So thank you so much in advance, both Jo and Alice, for coming. But because we always do this to our speakers, we're putting them on the spot, and I'm going to start with Alice. Your moment of the week, please share it with us.
Okay, so I think it's normally to do with food, my moment of the week. And yeah, I think this week I had an amazing Italian meal on Sunday afternoon, and I hadn't had such a good meal for quite a long time. So that's my moment.
Okay, my mouth's watering. What did you have for pudding?
I didn't have pudding.
No tiramisu.
Shocking.
No tiramisu. Oh my goodness gracious. It must have been a big dinner,
Yeah.
I suspect.
Okay.
Wonderful. I think there'll be many midwives who will be identifying with you, Alice. So thank you for that. How about Jo? Moment of the week from Jo.
I think mine is around my little boy rehearsing for his first nativity at nursery, and as he's been practicing his Christmas carols, he was singing little donkey on it, and as he got to on a dusty road, he went, but donkeys don't go on roads because there are too many cars, and that's where the ambulances need to go. Like,
Oh, I love that. That's a lovely moment. But didn't you have a lump in your throat when you did the little donkey?
Yeah,
that's the one
sweet.
with the little ones.
Yeah.
Oh, so sweet. That's lovely. Thank you so much for sharing both moments. Very, very lovely moments to share. Thank you for that. Now, I'm just going to remind everybody where we came from. And I don't mean exactly where we came from. I mean the Maternity and Midwifery Hour. We were born alongside the pandemic, and we were really designed so that midwives, student midwives, everybody in maternity services, because I know we do have a little following of paediatricians and a few obstetricians, I hope, maybe a few more tonight. And it was a way of getting information and professional development at a time when people couldn't go to conferences or study days. And also there was a real thirst for information and knowledge. And at the beginning, we talked quite a lot about COVID. We're talking less about it, though we still know it's still there and still a problem. And we all need to keep well and keep masks when we're in a crowded place and all of that, and get immunized. I won't get on my hobby horse just now, but the lovely thing about the maternity hour and the festivals is everything's recorded. Everything we do is recorded. So if you miss a moment, you can catch up. If you miss a whole hour, you can catch up. And it's all from our lovely people at Matflix, who keep everything in order. And you can go to Matflix and find anything you'd like. We've got over 1,000 sessions or clips that you can access, and they're all quite chunky clips. So if you're doing a little bit of a revalidation maybe, or you're doing a dissertation or a project for work, it's a really good source of up-to-date information. And if you're as a student, we also have these fairly good value subscriptions, so you could subscribe for a little while and get box sets that are kind of tailored with little reflective activities and little extra information, and they can be really useful. So do access those if you're interested, but certainly with the things like the hours, if you're enjoying it and you'll get your recording, you can share with your colleagues. We love you to share, really important to do that. And it does help you, because sometimes the first time you listen to things or see things, you don't hear everything. Sometimes it helps to recapture it and then talk to somebody about it, helps put it in your brain, which is always good. And it's all free. So that's fantastic. Now, a big thank you, as I always do, and I'm going to carry on doing it forever. A big thank you to our lovely midwives, student midwives, and everyone in the service who's working their socks off to make sure that the services for mothers and babies are keeping going. And I know at the moment it's difficult times, not just with COVID, but all the industrial action that's being talked about. People are quite uncomfortable and anxious about it. And there's a lot of press interest, which is maybe impacting on the work you're trying to do. So just look after yourselves and keep focused on what you're doing. And also, because I know that midwives do tend to be looking after everyone except themselves, I'm going to repeat that: look after yourself. Okay, and news this week. There's still a lot of discussion around industrial action that's going on with the train drivers and the rail workers and nurses and midwives. And so it feels as though the whole world is talking about it. So be aware of what's happening and where you're sitting with it. And if you haven't voted for whatever, vote, make your voice heard, whichever way it is, make sure your voice is heard. And also, the World Cup's still going on, and we had a little bit of a talk about that earlier between us about the World Cup, because it's still happening. I'm not a football person, but I like to watch just little snippets to maybe see a fantastic goal from Marcus Rashford, sorry, is a great favourite for all his work he was doing last year with the poverty. But also some of the lovely things. I've been seeing that Moroccan women giving out little sweets to fans around the place. It just lovely things that are like normal human nice things that are going on. That's really nice. And also going to say, because the tree here's the tree. I haven't quite finished it because it's not even quite December yet, not till tomorrow. But of course, the Norwegian tree from our lovely people in Norway that comes every year to Trafalgar Square has arrived, and we're seeing it in Trafalgar Square, and it's being dressed with all its lights. So that's all happening tomorrow. Just thought a little bit of festive feedback would be good. Now I've lost where I've put it, but I've got my Action for Happiness calendar. I always raise this as well because we're coming to the end of November. Today, and you have a little task every day. Today's task was look for new reasons to be hopeful, even in tough times. Now, isn't that relevant? How did they know that when they did that calendar? December's isn't out yet, but have a look at the Action for Happiness website tomorrow and you'll get your own. That'd be fabulous. And also for those of you who are on the examination newborn from All for Maternity, I hope you're enjoying that as well. Right, I've caught up with myself now, which is great. So I'm going to move without further ado to our topic for this evening, which is sustainability. And we've become much more aware, a lot of us have become very aware of the limited resource of our lovely planet and looking after our ecological systems. And it becomes very much in the news when there's a disaster happening like the floods or the fires, but we need to think a bit broader than that. Might become a little disconnected from midwifery practice, but they do matter. So the plastic that you put in the bin, every little bit of it has come from somewhere. We need to think about how we recycle things and use them wisely. And in 2020, the UK's NHS was the first health service in the world to commit to being net zero carbon emissions by 2045. First in the world. Hooray for the NHS. So that the initial steps have gone, and I think Jo will talk a little bit about this, but I know Alice will too. It's been quite focused on things like estates and travel, but of course the day-to-day practice that we all do has a footprint of some sort, and I hope we're going to explore that today. So I'm first of all delighted to introduce Jo Frame. She's a Chief Sustainability Officer's Clinical Fellow based with Green NHS and the Chief Nurse Office at NHS England. Jo's substantive post and her background is a practice development midwife, planning and facilitating MDT study and simulation days. And as part of this fellowship that she's on, she's working towards embedding sustainability within midwifery and maternity care by identifying areas for opportunity and launching sustainable quality initiatives projects, and by identifying areas for opportunity and launching sustainable QI projects towards achieving the NHS carbon net zero plan. So it's a huge task. So welcome, Jo. Thank you very much for coming this evening. The screen is now yours.
Okay, well, thank you very much for having me. So there we go. Okay, so yes, thank you. And just a little bit of background. So in September, I commenced the clinical fellowship with the Chief Sustainability Officers team within Greener NHS. And I'm also tied in with the Chief Nurse's Office as well at NHS England. So I could talk for hours, and I'm sure Alice could too, about sustainability. But today I really want to try and keep the focus on a bit of a summary of a greener NHS, why climate change is important within maternity, and what actions can be taken by us as individuals, as well as giving some details on some case studies as well. So back in 2019, the Director General of the World Health Organization, his opening report at the World Health Assembly, highlighting that climate change undermines the environmental detriments of health, clean air, water, sufficient food and adequate shelter, the foundation of Maslow's pyramid of human need. And we need those, and we know that those who are more vulnerable are also at greater risk of health inequalities. So closer to home, we know that within maternity care in the UK, women and birthing people of Black and ethnic minorities are disproportionately at risk of social, financial and health inequalities. And this feeds into the public health role that midwives hold throughout the country. In 2021, the United Nations also went on record supporting Sir David Attenborough's statement that climate change is the biggest threat facing humanity in modern age. Last year, air pollution was listed as a cause of death for Ella, the little girl pictured in the top left, a 9-year-old medal-winning gymnast whose asthma was exacerbated by air pollution. And this was determined because her asthma attacks correlated with local high readings of air pollution rather than a high pollen count. And then early this year, we saw record-breaking heat waves that resulted in extreme levels of heat stress, excessive amounts of fires, the busiest day that London Fire Brigade had seen since World War II. And more recently, the warm October we've just experienced was also record-breaking highs of temperatures. The 9 hottest summers on record in the UK occurred in the last decade. And thinking about other extreme events as well, this also ties in, it's not just about the heat, it's also things like flooding. These extreme weather events, as Sue said, does feel as though we're slightly disassociated, but they don't only impact the individuals and the communities, but they have significant implications for agriculture, the hospitality industry, the food supply, the economy, and therefore the well-being of every member of the population. There's also an emerging body of evidence about the impact climate change has on childbearing. So Alan Baraka, he is an environmental economist in America, and he's published several papers reviewing correlations between a rise in ambient temperatures of 10 degrees from a normal temperature in a particular region, and the association with an increase in preterm birth in those areas as well around the time of that increase in temperature. So there is significant impact on maternity services because this is not only just impacting the women, their pregnancies, but the whole of their lives. And as we are the people who give that initial care to the future population, this is why the climate crisis and the impact that we can have as midwives and the wider maternity multidisciplinary team, it's important, and we all have the ability to contribute to the net zero plan. So as Sue said, in October of 2020, the NHS became the first national health service in the world to commit to a carbon net zero plan in response to the growing threat to health posed by climate change. The report on the right, delivering a net zero health service, goes into this, and I'll be giving a little bit of a summary of that shortly. But it starts off by noting that the NHS is part of the problem as well as the solution. Everything that we do does have a carbon footprint associated to it. So the NHS is responsible for 4% of the UK's carbon emissions, and that equates to 40% of the public sector's emissions. So that's why we have got a responsibility to address this as well. So the publication of the amended Health and Care Act 2022 now also places a duty on NHS organisations to take action to mitigate against the impacts of climate change in their operations, making the NHS the first healthcare system in the world to embed net zero into legislation. So every ICB and all 212 NHS trusts in England, which includes over 1,000 hospitals and healthcare facilities, now have a green plan in place, which together will cut more than 1 million tonnes of carbon emissions in the next 3 years. And that's the equivalent of over 500,000 cars off the road. So these are huge ambitions. So these images are from the report, and I will kind of give a little bit of an explanation. So the plan itself is the target is to be net zero by 2040 for the emissions that the NHS directly control. So in this first image over here on the left is the emissions that we can directly affect. So our 2040 plan. The ambition is also that we'll be net zero by 2045 for the broader emissions that we can influence. So this is the NHS carbon footprint plus. So these are the emissions that we can't necessarily impact directly as an NHS service, but we could potentially influence, such as supply chain and the way that we facilitate travel. So every intervention that the greener NHS supports and suggests seek to improve health and patient care outcomes, reduce system inefficiencies, reduce health inequalities, and deliver a more resilient healthcare system. So delivering these goals requires action across every part of the NHS. And as the largest employer in Europe, all 1.3 million of us can work together to make this happen. So again, just going into that. So as you can see the colour code, on the pie chart, it gives the breakdown of what elements actually contribute to the carbon footprint of the NHS. And it's also worth noting that we talk about the carbon footprint, but a lot of these things I don't understand the sums myself, as I have nothing to do with the economic element and of it behind, but we talk about it as a carbon equivalent. So for example, when we talk about nitrous oxide, yes, it doesn't contain carbon itself, but calculations have been done to give it a carbon equivalent, just so that we are speaking the same language across the board. The third image here goes into the activity type. So within the report, it breaks down within the carbon footprint, the building energy, the higher contribution of that is in the acute setting versus ambulatory care as well. So these images are really worthwhile to have a look at and understand where it is that the carbon footprint is biggest, where we can have most impact, no matter how big or small. So what makes healthcare sustainable? This image that has been adapted from Stancliffe gives an overview of the crossovers to make anything sustainable. So this could be applied to a pregnancy, that in order to sustain that pregnancy, these are the factors that we need to make sure that the woman and her birthing person and the fetus are well throughout the pregnancy. This can also be applied to a team, a service, or the wider NHS as well. So we work from preconception, family planning throughout the childbearing period, and as midwives we give healthcare and public health promotion throughout. We do the initial work of ensuring that the environment for the future generation, quite literally in utero, is a healthy one to sustain their life. But then we do more by this by supporting the more vulnerable service users as well. So those who are at higher risk of either social deprivation, language barriers, For example, we put measures in there to help reduce the inequities. And we know that our scope as midwives is vast. So it isn't just delivering that initial maternity care. It is not just facilitating birth in whatever environment. It is a huge scope. And even in my work currently, explaining how much we do and what we do has dropped a few drawers on the floor. So here are a few case studies that I want to share as well. So up on the top left, at Great Ormond Street, they staff there reduced the use of single-use non-sterile plastic gloves. In doing so, they saved 21 tonnes of plastic and £90,000 in the cost of gloves ordered. So by using internal comms channels to raise awareness, and they developed a training package as well to reach all the nursing staff and healthcare assistants, the project changed behaviours and helped deliver health benefits for the staff as well as the environment. So they saw, just by analysing the procurement reports over a 12-month period, they were able to figure out how many gloves, compare the quantity of gloves that had been ordered, the saving, and then the carbon footprint of that. They also saw a decrease in skin ailments that staff were experiencing as well. So it had that health benefit for the individual staff members too. On the right, Charing Cross A&E, part of Imperial Trust, they did a project to reduce unnecessary cannulation, in their A&E department. So they did a baseline measurement as part of a quality improvement project, and they found that 86% of patients attending A&E were cannulated, and over 40% of the cannulas that were inserted were not used. A survey of patients also revealed that 68% of the patients complained about pain or discomfort at the site of cannulation. So this led to a year-long project. So it was an education programme, raising awareness. They designed posters encouraging staff to contemplate before you cannulate. These posters highlighted patient comfort, cost considerations, environmental impact around unnecessary cannulation, and as well clear actions to take. So they devised other visual prompts placed in key areas such as a traffic light risk assessment, and this helped empower clinicians to feel confident in not cannulating a patient. Phlebotomy staff were also empowered to question other clinicians, is this cannula really necessary, as a nudge to reconsider. After 12 months, an audit showed a 25% reduction in cannulation during attendance. So it went from 86% of patients to 61%. Of the patients who were cannulated during their attendance, it now went down from 40% not being used to 27% not being used. So this reduction is associated of a carbon saving of around 19,000 kilograms of carbon and a cost saving of nearly 95 grand. And when we are being pushed so much to be economically savvy as well, these environmental measures can also be of huge benefit. Down in the bottom right, this was at Sussex Community NHS Foundation Trust. So nationally, the NHS fleet and business travel accounts for about 4% of the NHS carbon footprint. And as a community trust, their carbon footprint was close to 5.5%. So travel was necessary as part of its work in delivering care out in the community, seeing patients in their homes. And due to the geography of the region, it means locations were harder to reach without a vehicle. So we know that travel can have a significant impact on the health and the environment. So that trust was working hard with travel to travel less when possible and as efficiently as possible when it was unavoidable. So making sure that clinicians, that if there were several visits in one area, that one clinician was going there rather than multiple dotted around. So here in this image is one of the health visitors there who the trust launched a pool of e-bikes for staff. So they also launched a booking system. So it was open to any staff that was doing community-based visits. And then they were able to book it and utilise these e-bikes to travel around. They were then able to utilise some bike lanes as well, and footpaths and cycle lanes, which meant that they could avoid traffic. And they also launched a pool of electric and hybrid pool cars for staff who wanted to utilise them, but not necessarily practical to use a bike. So the trust themselves, they now have 3 e-bikes dedicated to specific clinical teams, including the health visitors, and their sole use as well as a pool e-bike, and have covered around 8,000 miles in total, saving around 2 tonnes of carbon dioxide emissions. So the e-bikes as well, it's also allowed staff in urban areas to avoid traffic jams, as I mentioned, and patients, especially children and their parents, have fed back that they love to see the clinician arriving on a bicycle. So the health visitor pictured Polly, and she said that the families that she visits think it's great. They're concerned to make sure that the environment's good for the baby that they've just brought into the world. So they're pleased to see us on the bikes as well. And we can't forget that active travel also brings with it well-being and health benefits for the staff members themselves, as well as the reducing the emissions within the local environment and atmosphere. On the bottom left, we have Newcastle. So this one is much more applicable to maternity. So at the Newcastle Birthing Centre, Kaja, the mother pictured, was the first woman to use climate-friendly gas and air. So NOx as a greenhouse gas is 300 times more potent than carbon dioxide, and significant amounts of which are leaked and wasted on a daily basis throughout the NHS. So here, just behind Kaja, you can see what is called a scavenger and cracking device. So this neutralises waste NOx through an extraction pipe. So with the mouthpiece that is utilised, what is inhaled then gets exhaled as well, and it is filtered and neutralised. So this also has significant health impacts for the staff as well, because overexposure to high levels of NOx can also impact clinicians' concentration and drowsiness at the simplest. But when we know incidents are more common during the night, when staff's circadian rhythms may already be naturally impaired, this isn't going to help being 12 hours in a room with potential NOx leaks as well. So there's a lot of work taking place with anaesthetic gases throughout the NHS, but they are primarily being led by anaesthetists, and maternity as a whole seems to be one that people are hesitant to touch. However, there are things that we can do. So for piped NOx, simply by removing the pipe from the wall when it's not in use, can reduce leaks into the room. And as I mentioned, this not only reduces the leak, which has an environmental impact, it also reduces the waste, which has a financial impact to the trust, and it also improves the atmosphere for the staff that will be using the room, having a positive health and wellbeing impact. This was implemented in Hull, just this simple intervention. The financial saving was the equivalent of 1 whole-time equivalent midwife. So again, there are cost savings. So this slide here is just basically a simple example of some elements of midwifery that I've considered where there is potential to improve sustainability and or reduce carbon emissions. So if you look down, as I mentioned, the public health promotion, doing CO screening, that is obviously going to help the individual's carbon footprint if we support with smoking cessation. But then by that smoking cessation, we are then improving the well-being and the internal environment for the fetus, meaning that there is a likelihood that that would be a healthier pregnancy and hopefully mitigates against the risk of preterm IUGR births, and therefore mitigate against the potential of a NICU or SCBU admission potentially. Again, during pregnancy, we encourage active living and healthy lifestyles, going for more plant-based a lifestyle and diet. Not only has that health positive impact for the individual. But again, looking at the background of it, there is a big push to go to a more plant-based diet for the general public and the impact that that would have on the environment. As midwives, we are going to encourage breastfeeding for the health and well-being, the health benefits for the mother and the infant. But even for those that are either expressing breast milk or utilising formula breast milk, is there a potential for us to incorporate, rather than using just the single-use bottles in maternity units, can these be change that we can incorporate sterilisation on the unit? So therefore we're empowering these families to know actually how to safely prepare bottles, either for artificial milk or for breast milk that has been expressed. We do a lot of advocating and empowering for the women and the families that we serve. And again, this is often to reduce health inequalities. So many trusts do have vulnerable women's teams, whether that is social, whether that is substance misuse support, whether that is learning or physical disabilities, mental health, all those things, and making sure that there is accessibility to reduce those health inequalities as well. As individual clinicians, we are autonomous practitioners. So as I mentioned with the Gloves Off campaign, the Great Ormond Street launch, we have each clinical point that we deliver care, we have the opportunity to determine, do I actually need to use this single-use plastic, or is there an alternative that is more beneficial? And again, risk assessing the need for cannulation. I think it's fair to say that a lot of women, not a lot, but some women may also be unnecessarily cannulated just as a precaution. But again, are we right in taking that precautionary measure when we're thinking about the impact that it has on that woman and potential for infection at the site of cannulation if it doesn't get used? Again, there's also opportunities for unnecessary repetition through getting it right first time. And many of us are going towards digital care, and as was mentioned, community midwives with their green fleet and the Enternox waste. Within leadership, there's the sustainable quality improvements, and CSH do a lot of work around that. And there's also development opportunities such as hybrid roles, which we've launched 3 within the nursing through CNO as well. So yes, you may be one person, but there are 365 days in a year. So that's 365 opportunities to make a difference. There are over 39,000 midwives on the NMC register as of March 21, and as well as that, nearly 7,000 dual registered nurse midwives as well. So that equates to 22,391 full-time equivalents. And if we're working on the assumption of doing 12-hour shifts, 4 shifts a week, 47 weeks of the year, that's 188 working days. So if the 22,000 full-time equivalents made one change, like not cannulating unnecessarily, or not utilising a pair of gloves that did it for a procedure that didn't require gloves for 4 shifts a week for the 47 working weeks of the year, that's potentially 345,160 changes that we could make. So please never underestimate the change that one person can make as well. Have the conversations with leaders, consider the waste. Do things need to be single use, or is it actually a single patient use? And as well, network, find out about opportunities that there are. So apologies, as I said, I could talk on and on and on. These are some of the resources. Futures NHS Hub has got some fantastic resources there. And part of my project, I will be launching with a colleague a network for nurses and midwives specifically who are interested in sustainability, either have launched projects, are interested, don't know what to do, where to start. So if anybody is interested, please feel free to drop me an email and I will get you on the mailing list for that. Thank you.
Fabulous, Jo. Thank you very much. This is huge, isn't it? And I love this 7 million opportunities for change. Fantastic. We'll move back to that. But and those of you who are watching that want to send in a question, please do so, and it'll come through in the usual way. But I'm going to move very rapidly on to introduce Alice Clack. She's a consultant obstetrician and gynecologist with a special interest in sustainability and obstetric education in low resource settings. She's worked in obstetric and midwifery education projects in Liberia, Gambia, and Sierra Leone. And she's currently working as a fellow in sustainable quality improvement at the Centre for Sustainable Healthcare and an active member of the climate activist group Doctors for Extinction Rebellion. So this could be interesting, I think, Alice. So welcome. The screen is now yours.
Okay, thank you very much. And thank you for a really interesting talk as well, Jo. So hopefully you can see my screen okay. So what I'm going to be talking about really is just carrying on from where Jo's left off, talking a little bit more about the impacts on health and particularly on maternal health of the climate crisis. And then I'm going to introduce the principles of sustainable healthcare and sustainable quality improvement that the Centre for Sustainable Healthcare have developed, and then talk again, like Jo did, about a couple of examples in practice. Okay, so Jo has introduced the general contribution of the health service to climate change and discussed the NHS carbon reduction and sustainability targets. I wanted to give a little bit more outline of how the climate emergency is affecting and will increasingly affect maternal health. So the climate emergency has been identified as a health emergency as far back as 2009, when the Lancet, the medical journal, the Lancet launched its Lancet Countdown and released its first report on the impacts of climate change on human health. And since then, it's brought international experts together to release regular reports which track the impact of the emergency on health, from direct effects such as heat stress to indirect effects such as crop failure and migration. So awareness of the impacts of climate change on maternal health are also beginning to be described, although I think it's probably fair to say that we're a little bit behind many other areas of healthcare. And I'm just going to run a few of these health impacts which you may or may not have been aware of. So probably the best described negative impact on maternal health is the effect of air pollution, which is believed to result in up to 18% of global preterm births. It also has a negative impact on fertility, birth weight, and hypertensive disease. And the Royal College of Obstetricians and Gynecologists has, as a result, made a position statement on this subject and has been involved in advocacy efforts to the government. So less well recognised, but mentioned, I think, by Jo, is the impact of heat and extreme heat on maternal health. So it's been linked to preterm birth, low birth weight, fetal anomalies, hypertensive disease, and abruption. And it's been estimated that in heat vulnerable areas of the United States, that they are likely to see a 60% rise in cardiovascular anomalies associated with extreme heat events. And obviously the heat waves of this summer have demonstrated that this process is already well underway. So additionally, climate change is seeing a change in the distribution of vector-borne illnesses such as malaria and Zika, which have well described dangers for pregnant women. And importantly, also, previously unexposed populations are actually now coming into contact with these illnesses, which puts them at higher risk than exposed populations. And so this is definitely a growing issue globally. Climate change is also the causes of climate change, and climate change itself is also known to increase the risk of pandemics, which themselves often impact pregnant women more adversely than other population groups. Another underappreciated effect of climate change, certainly from the position of the UK, is the indirect effect that climate change is having on women and children through its effects on crop failure, flooding, and increasing conflict, which then increase migration. And women and children globally are especially vulnerable to social upheaval, and many gains made around sexual and reproductive rights are at risk of being lost. I mean, it's quite sobering to look at reports like the IPC 2022 report on impacts, vulnerabilities which predict that if we don't change direction, that we could be looking at billions of climate migrants over the next 50 years. And we were already seeing a reversal of some of the health gains that have been achieved globally over the last 50 years. So another area which there is currently limited research on, but sorry, going ahead of myself a little bit, limited research on is the effects of modern chemicals and microplastics on pregnancy. Although there is a need for more research in this area, it is felt that the small particles can act as irritants, and the larger particles leach chemicals that then act as endocrine disruptors and have the potential to cause cancer, diabetes, reproductive disorders, and neurological impairments. And very concerning is the fact that microplastics have now been found on both sides of the placenta. So we know that they can cross the placenta, and they've also been found in breast milk. And it's really difficult to establish what the exact risk factors for this happening are, and therefore difficult to advise our patients on how to avoid this, because we are living in a society where you can't avoid plastic, and so this is very concerning. So it's clear that we face massive challenges, and if we're to change our trajectory and address these complex problems to create a sustainable future, we need to think big, and we need to all be part of the effort to achieve this goal. But we are talking about our children's future and the future of the children that we deliver, and so it really is our responsibility to try and live up to this challenge and pick up the mantle, if you like. So I'm going to talk a little bit about some of the ideas that the Centre for Sustainable Healthcare have developed to try and support health workers in getting involved in this work. So we know that healthcare needs to reduce its environmental impact. And so the Centre for Sustainable Healthcare has proposed that an important step in achieving this goal is to ensure that sustainability is incorporated into what we consider to be quality, and that by extension, when we're measuring quality, we ensure that the value we're measuring includes sustainability. And what this should do is it should help us to embed sustainability into every decision that we make in the health service. They've also proposed, Centre for Sustainable Healthcare has also proposed these 5 principles of sustainable healthcare, which are represented here in this driver diagram. So the idea is that in order to reduce the environmental impact of care, we have 2 options. We either reduce healthcare activity, or we reduce its carbon intensity. And the principles on the right side of this slide can be considered to offer a holistic approach to change by making us consider the range of solutions open to us to achieve these goals. So to reduce activity, we can obviously prevent ill health, prevent complications. We can empower patients to care for themselves, care for their illness, engage in health prevention activities. Not health prevention activities, illness prevention activities. Or we can develop lean pathways, which limit the amount of resources and avoid waste. We can also reduce carbon intensity, so we can find low carbon alternatives to the pet care that we're producing, and make sure that our estates, our buildings are also sustainable. So they're presented in the order of kind of potential impact, with prevention and self-care at the top. And that recognises that although these are often more complex, difficult to achieve, that actually they represent the highest impact areas, because if we can really engage pregnant women in being healthy and avoiding disease, then that's obviously going to have a greater impact than having to tackle it further down the line. So a further tool that the Centre of Sustainable Healthcare are proposing was referenced by Jo, which is this idea of incorporating sustainability into quality improvement, because quality improvement is the change management tool that we use in the NHS. So it's a tool that we're increasingly familiar with as health workers and increasingly expected to engage with as health workers. So the idea is that by incorporating sustainability into this QI framework, that we can increase the engagement in sustainable work, and we can also provide tools to health workers to engage. So in this approach, instead of considering only patient outcomes and cost, which obviously are important, we also ensure that the environmental impacts and social impacts of change are considered. And we talk about what we call the triple bottom line, in which all both the environmental, social and financial impacts are considered while we look to improve and maintain outcomes for patients and populations. And it has been shown that this approach to quality improvement is motivating for students and health workers and increases engagement in quality improvement. So go to this. So this slide just outlines, is a quick illustration of the steps in the sustainability and quality improvement framework. And for anyone familiar with quality improvement, you can see that the actual steps are the same as for any quality improvement method. And so the idea is that you're not replacing quality improvement, you're supplementing it with a sustainability lens. And so each step kind of draws on sustainability principles and helps you to think about problems in terms of our environment, in terms of its environmental impacts as well as other impacts. Okay, so I'm just going to go through a couple of sustainability and quality improvement case studies. So this first one was carried out by an anaesthetist called Alifia Chakira, who worked up in Scotland. And it was really a groundbreaking study looking at nitrous oxide use. So nitrous oxide, as Jo mentioned, is a potent greenhouse gas. It's mixed 50% with oxygen to produce entonox, so it's very relevant to maternity care. And it's approximately 260 times as harmful a greenhouse gas as carbon dioxide. So we talk about it in terms of having a carbon dioxide equivalence of about 260. So the Alifia Chakira's goal was to reduce nitrous oxide emissions in the NHS Lothian Trust, and she started by studying the nitrous oxide journey through the whole 4 hospitals within the trust. So what she looked at was the pipe work, which are called manifolds, leaks, the stock management systems, and also the end user kind of use, if you like. And what she discovered was really pioneering, which was that well over 90% of nitrous oxide is wasted, so it's not actually used. And this finding, I mean, it's quite shocking, as this finding has actually been replicated in trust after trust after trust. And so it seems to be a fairly standard finding. Some trusts are finding that 97%, approximately 97% of their nitrous oxide is wasted. And this is due to leaks in the pipework, poor stock control, nitrous oxide going out of date, having to be returned to the manufacturer. And if it's returned to the manufacturer, it's just released into the atmosphere. That's how it's dealt with. And so it's quite sobering when you think that obviously it's important for us to change, to try and find alternatives to Entonox use, but these findings are almost certainly applicable to Entonox as well. And actually the majority, what we really need to be tackling initially is this massive wastage. So what she then did is she looked at tailoring interventions to each of the trusts according to what she'd found. So in areas where there wasn't very much nitrous oxide used, they got rid of the pipework manifold systems entirely and converted to using cylinders. They also improved nitrous oxide stock management and repaired leaks, etc. And over the project period, I'm sure this is much higher now, they avoided 2 million litres of waste of nitrous oxide with over 1,000 kilograms of carbon dioxide equivalent savings of £45,000. And just for interest, I know that one of the hospitals, Wrexham Mailer in North Wales, has decided that it's going to decommission all of its nitrous oxide manifolds in the hospital and convert to cylinders, and they're actually trialling exactly the same thing for Entonox over a month period. So they're about to do a pilot in getting rid of the Entonox manifolds as well, which I think is the first place that that's been tried in the country. So it'll be interesting to see how it goes and what problems or barriers that they find. So this next project is a kind of lower impact project, but also really nicely demonstrates what can be done over quite short periods of time. So this project was carried out by a F2 called Natasha Askroff, and she carried the project out over a 6-month period while she was based on a maternity unit in obstetrics and gynecology. And she wanted to reduce the amount of clinical waste on the labour ward and increase the amount of recycling. And she looked at doing this through increasing recycling facilities, education, and working out what could and couldn't be recycled. And she did a lot of work around looking at what was being thrown away, talking to estates and seeing which of those items were actually recyclable, and then created staff education posters along with the group. Obviously on the labour, it was a team effort, a group along on the labour ward, and so they were able through doing this to significantly increase the amount of recycled materials and of materials that were recycled. And this obviously has environmental benefit, but also a cost benefit. I mean, I think we've all had chats from estates begging us not to put non-clinical waste in the clinical waste bin, and describing the excess costs caused by putting things in the wrong bin. So correct waste stratification does have a potential financial impact as well as environmental impact. And this project was really well received by the staff, and actually was, following her 6-month project, adopted in multiple departments across the hospital, which so obviously has quite potentially large impact. So I won't talk about this in detail because I know that Joe's also mentioned this. Obviously, it is important for us to look at the end user impact of Entonox as well, and look at alternatives and ways of dealing with that, because Entonox, as well as being a very potent greenhouse gas, is also a really significant hotspot within the NHS. So we know that anaesthetic gases represent, and I'm going to forget the percentage, I think it's 3%, but I apologise if I'm wrong, 3% of the entire NHS carbon footprint. It might be 2 carbon footprint, and of all the anaesthetic gases, nitrous oxide represents 2/3. So it's the most significant proportion, and of all nitrous oxide, 2/3 is represented by Entonox. So Entonox is it represents the majority of nitrous oxide that is emitted by the NHS. So it is a significant impact. Okay, so I'm just going to end by just signposting to some of the Centre for Sustainable Healthcare's resources. So we have a website called susqi.org, so sustainablequalityimprovement.org, which has signposting to a number of open source resources. So there's a step-by-step guide which takes you through the steps of carrying out a sustainable quality improvement project, and provides guidance and resources and materials to help you do that, as well as reporting templates and presentation templates. And there's also resources, open source resources under the Teach SusQI icon, and we have an educator pack on there which is free to access and provides educational resources so that QI leads and educators can teach sustainable quality improvement. There's also signposting to our Centre for Sustainable Healthcare website, where there is a networks platform. So this is to try and encourage community building around sustainability work. There's currently no women's health network. The platform's been reorganized, and I've requested that we can have one started once the new platform is developed. So I am hoping that sometimes next year we will have a women's health network on the platform. The centre also runs a number of short courses where so they're one-day courses, half a day directed learning, and then half a day online face-to-face course, and I'd really recommend these as a really good introduction to sustainable healthcare. So probably particularly the introduction to sustainable healthcare is a very nice overview. And then if you have an interest in quality improvement and engaging in quality improvement, there's also a sustainable quality improvement course. And of course, it's, there is a growing number. Every hospital trust now has to have its own green plan, and I'm sure most hospital trusts now have their own green team. So I would encourage you to connect. If you're interested, connect with those teams, and because it's important to share ideas and also gain encouragement to undertake this work, because it can occasionally be a bit frustrating and feel a little bit overwhelming. And obviously, as a member for Doctors for Extinction Rebellion, which has just been rebranded Health for Extinction Rebellion because it's not a doctors group, it actually has all health professionals represented, I just wanted to also highlight some of the other healthcare climate groups that are out there, because you can also get involved outside of your place of work. So as well as Health for Extinction Rebellion, there's also Health for a Green New Deal, which is run by MedAct, which is campaigning around a climate justice approach and the need to invest in an alternative kind of green future. And there's also Health Declares, which is an organisation that supports health workers to advocate for divestment from fossil fuels and climate action in the organisations that they're a member of. So all good groups to be involved with. And yeah, that's where I finish, and I think we'll move on to questions. Thank you very much for listening.
Fantastic. And finishing with David Attenborough is just lovely, because it all comes around. I mean, I think this is a huge area, and this is anyone who's listening and thinking, oh gosh, drowning in it. I mean, some of the things about Joe was saying about, does it really, one person, what difference can you make? Because you could kind of think, because you hear it, don't you, on the television interviews, where someone will say, well, I'm doing this, that and the other, but look at China, or look at India, or look at someone else. But it does come down to you as an individual, doesn't it?
Yeah, definitely. And eco-anxiety is definitely a thing that most colleagues who are interested in this have experienced. And I think my most recent hit of eco-anxiety is trying to produce some information about the Gloves Off campaign and replicating that on different wards in different units, whilst I was watching a documentary about the Ukraine. And just thinking, and as the camera just panned out of Mariupol, I was just kind of like, I had that moment of, oh my God, what difference is one pair of gloves going to make when there's that? But that's the thing, every little does count. I don't mean to reference a superstar there, but everybody can make a contribution.
Yeah. And I think what Alice was saying made me, because especially around the project about actually reducing waste in a unit level, of getting the bin, it's the basic stuff of having the bins that you know where to put stuff, and not everything in the clinical waste, because some of it is, it's not about people being lazy, it's just busy people. They're trying to find a bin. Where do I put it? Where do I put it? And if you've got everything labelled, and I'm kind of thinking of the last time I was in my local unit, had a baggage of stuff, and it wasn't clear to me, one, where to put the things, each individual, like cardboard, paper, tinfoil, whatever, but also other people. When you look in the bins, there's all sorts of stuff there, and you kind of think it's not just us that's got to think about it, but it's the ancillary staff, it's all, it's visitors, it's patients, it's everybody who's participating. I mean, I'm getting a lot of wows from people. No, not very many questions. So if anyone has a question, you only have a few minutes to get your question in before we lose our lovely speakers. But and I was thinking, I found personally very interesting the whole discussion about entonox, because if you'd said to me that there's that much wasted, God, 90% wasted. So just going up.
I mean, it is really shocking, and I think it does underline the importance of that step of studying the system. And like you were saying, just anything even as simple as a bin, you're looking at the way things work in your environment and seeing where the opportunities for improving it are. And I find it particularly interesting because I was interested in trying to find alternatives to entonox. So I was working my trust with, well, could we improve access to remifentanil PCA, for example, for the women, obviously, that were being cared for on the high risk side of things. And then when I read this study and realized, actually, obviously that is important, but probably 95% is just being leaked out the pipework or wasted because of poor stock management, then you do need to think about where the hotspots are, because we do need to move quickly. We do need to reduce carbon quickly. And so by focusing on the high gain areas, then, that's obviously important, but it's equally important for everybody to be engaged. And so that's why, that's where all of the kind of all of the steps are important.
And it was interesting also we're going back to cylinders, which it's kind of almost back in time, and yet that that's kind of more practical inside that's what you're saying, because it's less likely to leak.
Yeah. I mean, when you think about some of the so-called advances of the last 20 years, you know, single-use instruments and you know, throwaway material. I mean, you know, all this kind of disposable packaging. And you do, you know, it is sobering. You realize that actually that we've just been going in the wrong direction for a long time, and a lot of it is rediscovering the ways that things were done in the past.
Yes, gosh. And also, I mean, the other thing I don't know if you've been looking at that, but I think someone mentioned about having solar, and this is about energy, but I guess it's also about good use of energy and resources. But somebody was saying that we should be able to do things like putting solar panels on hospitals so they could generate their own energy, and therefore reduce having to, you know, use wider sources. I don't know if that's come up in discussion.
There is a project called Solar Saving Lives, where that has been implemented, but as well the at one of the sites, the energy that is being fed back into the grid is also going towards funding for a local charity that are then able to support at-risk individuals with heating their own property in a bid to avoid any cold weather ailments that would require them to then be admitted into hospital. So there are a lot of fantastic things. And one of the resources that I shared, the Futures NHS hub, they've all, two of the fellows from last year actually developed a toolkit that is available on there for reducing nitrous oxide waste. So that is a fantastic resource to look into as well.
Oh, fab. So remember, everybody who's watching, you've got these resources. They're all on the list. And if there are any not on the list, you've got the email for both Joe and Alice, so you can ask them yourself anyway. Now, I think I had a question coming through because my little phone is buzzing here now. Oh, a comment. Eunice Niazari at Sally. I'm going to say Eunice. Hi, Eunice. She says this is an eye-opener and a conversation we need to talk about. That's grand. Now I've just lost my power here for a minute because they're meant to all come through my other screen and they're not coming through. And then another comment from Liz Hick. Hi, Liz. She says our trust have been looking at Entonox leak in the birthing rooms and the effect on pregnant midwives, looking at ways of checking the leaks and the long-term effects. Massive. So this Entonox seems to be a very big one on here too. Okay, so we've got also Joe Dasguston. Hi, Joe. Great episode. Are all case study examples including a PPI perspective, please? That might be one for Alice.
So was it asking for more case studies or signposting to the case studies?
No, Joe is just saying, are all case study examples including a PPI perspective? That's pure question.
I'm not entirely sure.
Well, Joe, can you clarify what you're meaning, and we'll re-ask. Okay.
The case, that case study that Joe highlighted about Great Ormond Street is up on their website, and I think it's signposted to on the CSH website as well. It's a great project, and
all the case studies I mentioned are on the Greener website. Yeah.
Okay, that'll help. Okay. And then we've got Sherelle. Hi, Sherelle. Says, not a question, but an observation. Increased exposure to Entonox poses health risk to midwives as well, B12 deficiency, as Joe explained. Then that has far-reaching impact on the health service with time off investigations, etc. So we've got a good interest in Entonox here. Excellent. Another one from no, we had Liz, haven't we? And we've had Eunice, and I'm finishing Eunice's properly because I lost half of it. This is an eye-opener and a conversation worth picking worldwide. Thank you, Eunice. That's an absolutely good point. Absolutely good point. Well, what I would say is I know I'm very mean because, of course, I always say this hour goes faster than any hour in the whole world. And we've had so much information and some wonderful resources to really get us going. And I think that the kind of key things is for us all to think about is how can we influence this? And it might be an issue of my biggest change I'm going to share for my washing up. And that is, I used to get these little sponges. You get a little pack of sponges, ever so cheap. That's the problem. All these things are very cheap. And you use this little sponge and you use it maybe for a week and it gets really, really manky. And you chuck it away and you get a new one. And I found out about loofahs. You know, the things you wash your back with in the bathroom? You get little loofah pads about that big. And they're a bit scratchy and they are fabulous for washing up. And they last ages. You just sterilize them occasionally, and then when they start falling apart, which they do, you pop them in the compost because they're made of a natural plant fabric. Biggest thing for me. And also, you know, cosmetic, instead of cosmetic sponges and things, you can use cloth things. And some of these things actually, and it's a bit like the cylinders that Alice and Joe have both pulled up, they're actually nicer than these new things that we've started using. So going back to reusable things, they have a huge value. So thank you so much to Joe and Alice for joining us. I think we'll have to have you back further along in the story, please, because I know there's a lot of interest, but we only have the hour, but we will revisit you. I'm just going to say a big thank you to both of you. Thank you to Amy, who's behind the scenes, making sure it all works beautifully, and Paul and Deborah also in the background, making sure questions come through nicely. Now, this will be through with resources in the Facebook on Friday. The podcast will be around first thing Friday for those of you who are into podcasts. Next week, we've got Maeve O'Connell and Gina Souza coming back to do a part 2 of developing global midwifery education. Don't forget to book for the student experience event. It's now 11th of January 2023. Can you imagine it? And the London Festival 7th of February 2023 also, and it's going to be fantastic, just as yesterday was lovely. And I didn't even talk about that. I had to share that with you next week. But in the meantime, thank you for coming in to see us and joining the discussion. Take care of yourselves. We'll see you next week.